Chair recognizes the gentleman from Bullitt for explanation of the bill and a motion thereon.
Thank you, Mr. Speaker. I never like to refer to legislation as a simple piece of legislation, but I will refer to this bill as good common sense legislation. At this time, before I begin discussion, I'd like to ask the clerk to report House Committee Substitute 1.
Mr. Clerk, please report.
House Committee Substitute 1 to House Bill 148.
Gentleman from Bullitt.
Move for its adoption.
Motion made for the adoption of House Committee Substitute 1. Is there any discussion? Seeing none, all those in favor, please signify by saying aye. All opposed, nay. Motion carries. House Committee Substitute 1 is adopted. Gentleman from Bullitt.
Thank you. Currently, for out-of-network providers, many health insurance companies will not send payment for services rendered to the patient insured directly to the provider, but instead funds are paid directly to the patients or the insured. The expectation is that they will in turn pay their bills. This is because many of these insurers have anti-assignment clauses as part of their contract, so even if the patient is insured, the patient or the insured instructs the insurance company to pay the provider directly, it won't be honored. This pay-to-patient model for out-of-state network models has been outlawed in 17 states for all of healthcare, and 7 other states have specific provider group carve-outs that bans this practice. So I want to talk for a moment about what House Bill 148 does. This bill first came to my attention from a provider in my district that was having, they were treating substance use disorder, and individuals who were being treated were receiving direct checks for the services. And sometimes you would have a situation where a person in recovery may receive a check for thousands of dollars. The expectation, as I said a moment ago, is that that check would in turn be given to the provider, but that is certainly putting that individual in recovery in a delicate situation and not a good situation. So what does House Bill 148 do? It requires health insurance companies to recognize a patient's assignment of benefits for substance abuse or mental health facilities only. Under this proposed bill, patients of substance abuse or mental health facility will be allowed to instruct their insurance to assign and pay benefits directly to their treatment provider of choice. Due to the nature of substance abuse and mental health disorders and the severity of the drug epidemic our state continues to face daily, I believe the carve-out for these providers in House Bill 148 is necessary. Providing access to such funds to these vulnerable individuals has and will continue to lead to a relapse, overdose, or even death. We do not believe it is good public policy for our Commonwealth to allow very large checks to end up in the hands of someone in recovery. House Bill 148 specifically addresses that problem, and I would add that House Bill 148 does not apply to Medicaid or Medicare. House Bill 148 was a compromise piece of legislation between providers and insurance companies, met and at my direction worked out an agreement to make this bill acceptable. So I want to explain for a moment what House Bill 148 with the committee substitute does as the compromise portion. The committee substitute is the work product of discussions and negotiations between Anthem and the SUD treatment provider community. The parties have agreed to the language in this committee substitute. The committee substitute does not make any substantive changes to the underlying bill. It simply provides some additional safeguards in the assignment of benefits process between the provider, the insured, and the insurance company. Some of these requirements include submission of a more detailed statement from the SUD or mental health provider to the insured about the charges in the AOB process they will face, a time frame on when AOB claims can be submitted to the insurance company. SUD and mental health providers must maintain claim records, and providers must respond to inquiries regarding the AOB benefits for investigative units specifically related to fraud. The committee substitute also provides a provision to protect against potential bad actors and promote quality providers by requiring SUD and mental health facilities to follow their applicable recognized standard of care. Mr. Speaker, that is a description of the bill and the committee substitute and the rationale behind this bill. At this time, I now move for the passage of House Bill 148 as amended by House Committee Substitute 1.